Jason Altman. I'm a board-certified plastic surgeon in Coral Gables, Florida, suburbs of Miami. I have a practice focused primarily on rhinoplasty and breast surgery with ancillary focuses on body contouring as well. I've been in this location in Coral Gables for about 4 years now and in practice for almost 10. We decided to bring in BodyTite and FaceTite into the practice here in Miami because there's a growing demand in the community and I think in the world as well for less invasive, more effective procedures. Given our location and the volume of our practice, we're courted often by various sales reps trying to get us to incorporate their products, and I'm very hesitant and reluctant to bring something into my practice unless I really know it works and adds value. Especially in this community where patients are really excited and not afraid of surgery, a non-invasive product really has to demonstrate a substantial result to make it worthwhile. And BodyTite was really the first product I'd come across that had shown those results to both me and my patients, giving us the ability to tighten skin, which is a buzzword, but it's one that gets patients super excited. You know, if you can tell them you can tighten skin without scars, and now you can start bringing in other aspects of patients to your practice that really would not want to have a surgical procedure, arms, legs, necks, things that the surgery involved produces pretty large scars, pretty large downtimes. Now I can get patients in, treat them in an hour, get great results for them. That was sort of the breaking point for us to invest in something that we wanted in our practice. BodyTite is a technology based on radiofrequency energy. The BodyTite machine uses bipolar radiofrequency energy to direct heat from an internal probe to an external surface detector. And in doing so, it creates a fairly concentrated field of heat and energy, which allows us to direct that energy to very localized areas of the tissue, causing tightening of the tissue directly, as well as stimulating collagen production in the dermis, which offers sort of long-term tissue tightening and improved tissue elasticity over time. The bipolar nature of it not only allows us to get higher effective temperatures in a local area, but also provides a significant margin of safety over other devices that are just spewing heat out into the tissue haphazardly. This way, we're really able to limit and control the peak temperatures that we achieve in the tissue and avoid things like collateral tissue damage, surface burns, etc. To me, BodyTite is not an alternative to liposuction in any way, and I don't use it like that in my practice. To me, BodyTite is an ancillary procedure that I associate with liposuction. So a patient that requires significant volumes of fat removal is going to undergo liposuction, and the BodyTite is going to come in as a secondary procedure, usually at the same time, to enhance the result by tightening the surrounding tissue and improving the skin quality. There are other patients that have skin laxity without significant fat, and they're great candidates for just tightening procedures, neck procedures, lower abdomen. But so to compare BodyTite to liposuction, I don't think is a fair comparison. It certainly has its FDA approval for fat reduction, and it does do some lipolysis through the heat, but I think the primary benefits of it are less about fat reduction and more about tissue tightening. BodyTite, as opposed to traditional surgery for procedures such as facelifts, brachioplasties, thigh lifts, again, it sort of fills a void. I never sell this procedure as an instead of procedure. It's almost always an alternative in the sense of someone who's not ready for a more drastic procedure or someone who doesn't want a more drastic procedure. So it's a great procedure for those gap patients that definitely have a problem that needs improvement, but the problem either isn't severe enough to require surgery or they're not ready to commit to a surgery. I never promise my patients surgical results from a procedure like this, and patients aren't expecting surgical results from non-invasive or minimally invasive procedures. But if you tell them I can get you 30, 40, 50% of a surgical result with no scar, much less downtime, much less risk, they're dying to have that done, and that's where I see this working in our practice. BodyTite has brought a lot of benefits to our practice, and when I talk to people about it, I tend to break it down into a three-factor modality. The first and probably the primary use of it for me is as an ancillary or quote-unquote upgrade procedure with liposuction. At this point, virtually all, 90+% of the patients that come to my practice and are offered liposuction as a treatment modality are also offered BodyTite along with it, with the exception of that very young 18 to 20-year-old patient that hasn't had any children, hasn't had any weight loss, and just needs very low volume liposuction. Almost anyone else can benefit from the addition of some tightening along with their liposuction, especially when we're doing arms or legs or back where you don't get as much tissue tightening as you do in the abdomen. So as an add-on to liposuction, it's an amazing, both in terms of patient satisfaction as a revenue generator. The second mode that I use it a lot in is as a primary treatment procedure in patients that either don't want surgery or don't necessarily need surgery yet. There I'm using it a lot in the face and neck. Patients don't want facelifts. Men don't want the downtime or the scars associated with that. This is a great 30-minute procedure. Go back to work the next day, local anesthesia. So it adds a whole new patient population to our target audience that we can offer things to now that in the past we really only had surgery to offer them. And then the last group is, it's great to salvage cases in your practice. It's great as a touch-up. You have a patient that doesn't have a perfect result, or that might have had a procedure done somewhere else and doesn't have an ideal outcome. Or you've done a facelift and there's still a little mild laxity left in the neck. We've all had those patients that still have a little looseness up here. Post-abdominoplasty, they may have a little upper abdominal laxity. This is a great way to convert that patient from someone that might be moderately happy or even mildly unsatisfied into a really happy patient with a very minimal procedure that has very little cost to you and very little downtime to the patient. For the patients, it's the obvious benefit of the results, right? Patients come in, they get a treatment, they get to see immediate results, which is really what's nice about this BodyTite and FaceTite, is that a large portion of the results they see right away. They get up off the table. Our office staff is always amazed by what they see when they're undergoing their treatments, and patients can go home and see an improved result right away with the knowledge and the understanding that they're going to get continued results out 3, 6, 9, and even 12 months out from the procedure. So for the patients, the benefit is that they get to have something done, they get to look and feel better, and they really have very little, if no, downtime. Most of my patients take no pain meds from this medication, and almost all of them are able to get back to work in 48 hours, mostly in 24. I have a surgical practice, and people come to me for surgery, but definitely as technology advances and they're more and more direct-to-patient marketing, and patients are much more self-aware now of what's available out there, they're always seeking not necessarily a non-surgical result or non-surgical procedure, but they're looking for something with less downtime. They're looking for something that involves some technology, and patients don't necessarily want to miss a week or 2 weeks or 3 weeks of work. So they're very excited about a technology that can offer them visible results with none of that or minimal downtime. Most of our patients, or many of our patients in our community, have tried a lot of other technologies and they've been disappointed. I'm not going to name names, but they've all had something done, whether it's radio frequency or laser-based or heat-based. They've spent a lot of money and they've walked away thinking, maybe I see something, but I'm not really thrilled with that. Whereas now we can really give them something that they go home, they look in the mirror, and they see a difference, and they feel that they've gotten value out of what they've had done. BodyTite has been a great revenue source because, again, going back to what I said and how I use the surgery, or how I use the machine and the technology, as an add-on to liposuction, it's instant revenue generation, right? Because now you can add on treatment modalities to patients already undergoing treatment, already paying for something. So it's very easy for them to accept an upcharge on a procedure that is going to give them a tangible improvement in their results. Beyond that, it opens up a whole new world of patients that we didn't have as a revenue source, who are only looking for non-surgical options, and we're not really the Botox filler type candidates. Now we have something to offer them, and that's a brand new revenue source. So it's enhanced existing revenue sources, and it's also brought new revenue sources into the practice that we didn't have before. I think there's always been sort of that search for non-surgical procedures, but in the past, patients were always looking for them, but they weren't willing to compromise results for them. Especially here in South Florida, we have a patient population that's grown up accustomed to plastic surgery. They're very used to it. They don't fear surgery. They understand it, and they often come seeking it. It's not uncommon to have young 40-year-old women coming in asking for facelifts. But now that we can give them results with something non-surgical, it definitely allows us to open up to a younger patient population to start enhancement procedures at an age before they were necessarily ready for it. Morning.
Hi, good morning.
Good. You ready? Excited?
I am.
Okay, awesome. So today we're going to be doing neck tight and FaceTite, right? So we're going to be introducing a little small electrode under the skin to tighten up the tissue here in the neck, the jowls, and the lower part of the face, okay? So let's start by marking the areas, okay?
Okay.
I'm going to draw all over your face, okay? I'm going to be marking out both where I'm going to get my access from, okay, as well as the areas we're going to treat, and I'll put a few marks on there to remind us where some of the important structures are. Okay, we know where they are, we won't hurt them, but we want to make sure everybody else does as well. Okay?
I'm good.
Okay, so look straight ahead for me. Try to relax your neck a little bit. Good. And we're going to start by just marking out where the area that bothers you is, as well as the lower border of the mandible. Okay, we're going to come and circle around the jowl where we're going to treat. And because there's a little more tissue there than the rest of the neck, I outline that. It allows me to know that I can deliver a little extra energy to that area. Same thing over here. I always make it a point to palpate for the facial artery, and you know that's where your nerve is going to be crossing above. And we'll just mark that out as well. Okay. So we're palpating the facial artery so we can identify where the marginal branch of the facial nerve comes up over the mandible. That's an area. We can still treat that area. We just need to make sure that we are safe over it in terms of maintaining our depth. Okay, and then we're going to treat the lower face as well. So I'm going to take a line from somewhere around the root of the helix or the tragus out to the oral commissure. Same thing on this side. And you can kind of follow the natural curve below the cheek pad here. And then the last thing we're going to mark is we're going to take an approach to the oral commissure as well to try to get this jowl area here. Tighten that from both directions. Again, you can see we're coming over that area where the marginal is, and so we just always want to keep in the back of our head to be aware where that branch is. Lift your neck up for me now. I'm going to divide the neck into sections. I tend to divide it depending on how much I'm planning on delivering. I split the midline, and then often I'll divide into an additional wedge here and here. I think on her we're going to be fine just like that. We'll mark a little access point behind the ear. That'll give us access to this area, and then we'll come in through the oral commissure as well. All right?
All right.
Any questions?
Nope.
No? Feeling good?
Great.
Okay, she's received 1 milligram of lorazepam sublingually. We'll probably give her an additional dose. Most of my patients receive oral sedation for this. Some of them opt not to. They all tend to tolerate it fine. The tumescent really does a good job of numbing up. So we will lay her down. I'll inject and infiltrate her with the tumescent. Then one of my assistants will come in and prep while we're giving that time to work. It is important, especially when they're awake, to really give your tumescent a good, I know it's hard to wait the time, but give it a good 7 to 10 minutes to kick in. You'll see blanching of the skin and you'll know you're good to go. Okay?
Yep.
And Gab's just bringing me a 20 cc syringe as well. So we're going to start injecting the local. What I do is I pre-inject the incision sites with straight 1% lidocaine with 1 to 100,000 epinephrine, little 30 gauge needles so they don't feel anything. And then for the infiltrate, depending on how much volume I need, I'll either use the regular tumescent solution, 500 or 1,000 of normal saline with 50 cc's of lidocaine and 1 amp of epi. Or in this case, since it's a more focal region, I'm using something a little more concentrated. So with her, we're going to use 0.5% lidocaine with 1 to 200,000 epinephrine. And I'll just inject that with a spinal, 22 gauge spinal needle. We'll get started. We're going to do a shot here, and a little shot behind the ear. Okay. Feel a little stick with a little pinch. Okay. 1, 2, 3. Not too bad. And this is just so they don't feel the larger bore. Open your mouth a little bit. Perfect. We're going to use the corner of your mouth. Okay, 1, 2, 3. I know that's the most uncomfortable one. Good. Same thing here. Okay, turn your head away from me a little bit. I'm just going to get one back here behind the ear. 1, 2, 3. Great, and other side. Okay. So let that kick for a minute, and then we'll inject the tumescent. In someone like this patient, where there's very little submental fat, I don't plan on doing any liposuction on her. But the infiltration is really important because not only is it obviously going to provide the anesthetic, but it's going to give us a little bit of depth. You know, we want to be able to keep our cannula tip a minimum of 3 millimeters below the surface. And in someone this thin, sometimes that can be challenging. So the infiltrate will allow us to thicken that subcutaneous tissue. So you're going to be really generous with it. And if you feel that, you know, you're getting close to your lidocaine maximum, you can always just mess with a little extra normal saline if you need a little more thickness there. I do a lot of work in the neck, so I'm comfortable with a spinal needle. Some people prefer an infiltration cannula. Okay, so we're just going to start. Okay, I'm going to numb everything up. It's normal when we inject the anesthetic. Your teeth may feel numb, your lips may feel a little funny. That's all totally normal, okay? That's all an effect of the anesthetic itself. I do put bicarb in my infiltrate. I find that it does make it more comfortable for the patient. And you can see I come all the way up into the jowl and beyond whatever area we're planning on treating, so that if we do find contour irregularities, we can continue to treat beyond them. There is some adrenaline in here, hon, so you may feel your heart racing a little bit, okay? And again, that's totally normal. You okay? Good. If I'm going too fast, let me know. Remember, I'm used to my patients being asleep, so I tend to move quickly. But you're doing great. And down to about the level of the thyroid cartilage. Her primary concern is that submental, we'll call it a waddle for lack of a better term, right? That sounds like something we really should fix. And you can see with the combination of the benzo and the pre-injection, they do really well with this. If I'm combining modalities, if I'm doing Fractura or something else at the same time, I'll usually either put on a topical BLT or I'll do a little more of an infiltrate superficially. I'm going to come back in here. You should be nice and numb. And we'll just finish. Not much different than tumescent you would use for a traditional facelift. And especially in this area, turn out as much as you can, good. Where you're getting over that parotid fascia, the tissue's really adherent and your depth is going to be shallow, so you really want to get as much infiltrate as you can in there.
Shall we raise the bed?
So I'm not hunched over as much?
Yeah.
You sound like my concerned anesthetist. Yes, we probably should. So same thing on this side. Little pinch. Okay. that big turn as much as you can. Perfect. Again, that area where we marked our marginal branch, you'll see I have a lot of tumescent there, and that, again, going to give me that margin of safety. They'll often wake up with a little weakness from the anesthetic. It's nothing to worry about. It will resolve, and as long as you're staying at depth, you're not going to have any issues with that branch as it comes up. So I do a standard sort of either betadine or chlorhexidine prep. So we're all done with our injection. We did 110 cc's total, which included 100 cc's of the 0.5% lidocaine with epi, as well as the 10 cc's of bicarb. Okay, that was perfect amount to get nice, even infiltration throughout the lower face and neck. With the small cannula, you can gain access with a 14 or 16 gauge needle, or you can use an 11. I find that the 11 is just a little more precise. You get a linear cut instead of a round one. And because we're not doing suction here, I'm still going to undermine with a very small liposuction cannula. We're going to make our first access, just the very tip of the 11. I'm just making enough space that I can get through with my lipo cannula. And I use a really small, I have like a 2.4 millimeter lipo cannula. Okay, so tiny little spatula tip. I'm not doing this on suction, but if it was a patient that needed suction, I tend to do my suction ahead of time. It is nice to be able to get in when you're done and remove the oils. You're going to feel some pushing and some pulling and some pressure. Okay? Cannula in, holes away from the skin, and I'm just gonna kind of create a pathway here. Okay? It'll confirm we have good anesthetic before we apply any heat. And you can see she's pretty easy, just back and forth, gently undermining that tissue. So I will come up into that jowl and really get under there. Sorry, my hand is covering it, but for safety, you always want to be kind of feeling the tip of that cannula. You can see where we are depth-wise. Okay, there's a good layer of tissue above us. And you can see the patient really tolerates this well, okay? You can see, you know, if you don't pre-undermine with this, the flexible nature of the tip would make it a little difficult to pass. I think it adds a margin of safety, and that you know the easier it is to pass that tip, the less torque you're going to get on it. Okay. And again, up over the border of the mandible into the jowl. And now we are really moving freely. We're done there. I'm going to undermine everything at once, so we'll undermine the lower face as well now, so we have that clear space undermined. And I'm going to do the same thing here across your cheek, okay? I'll take the same 11. And here we have the parotid fascia, so there definitely is a little more resistance initially. She will feel the tension there as soon as we get under. And again, you want to make sure you're in a uniform plane, so you're just gently separating that superficial fascia. Once you're there, it moves fairly easily. You may have to jam here and there a little bit. And out past the parotid, it's very, very smooth. And we can kind of reconfirm back into our jowl. And I don't want to undermine through the commissure. I'll just use the needle for access there, so we're going to come all the way out to the commissure with this. I know it feels a little strange. You can kind of feel that moving under the skin. But as you can see, pain-wise, they really tolerate this well. Okay? That's that, and we're going to do the other side now, okay? If she was thicker, not the lower face, but the neck and the jowls, I would have done with low suction. Same thing, we'll just hide that access where we gave her that initial dose of lidocaine. Same thing, a little rough on the introduction. And once you break up over the parotid, everything runs nice and smooth. I'm just feeling, you can see uniform depth throughout. That's really the most important thing here is you want to create a uniform field so you're always tightening the same tissue plane, and we'll just come right up to that oral commissure again. And double up under the jowl. Okay. So the face cannula, internal, external. You can see this is flexible, so it's nice. You're not going to damage anything with it, but that's where you need to always just sort of be aware of your tip position, right? Because you can get some yaw out of this, where you get lateral motion, and you really want this centered over the external temperature sensor, and you can get flexion. So if you're torquing, you can wind up with your tip a little too close to the surface, and you'll see that once we introduce it. Okay. So we are set to 38 on the external. Our internal is set to 65. That's definitely the highest you want to go in this area, and I would work your way up to those numbers. We're going to set our treatment time to 120 seconds. That's a safety precaution. That just means you have to take your foot off the pedal every 2 minutes. It's a way of making sure you're not falling asleep during the procedure. The machine's now out of standby. The first thing I do every case is I test these hand pieces. I'm going to pinch the external, and we're going to look for a rise, on the internal temperature. You can see it very quickly responds. I then test the external sensor, make sure that rises, and both of those are functioning, so we know we have our safety measures in place. I'm going to apply, that's sterile ultrasound jelly. Cools the skin and assures a good contact between that external sensor. This is what we use here, sterile aquasonic. It comes in 100-gram packets. I keep them cool. It helps pre-cool the skin. You can also use them during the procedure. If your external temperature is getting hot and you haven't reached your goal internally, this will cool that skin off and protect it while you can continue to deliver energy to the deeper tissues. Okay, and we're going to treat in zones, so we're going to come up. You can see from our pre-tunneling now that the cannula really moves fairly easily through the tissue. Okay, and again, when I first did these, I would try to do everything through a single access point. The access points are so small, you're much better off with additional access points, especially in curved structures like the neck. What you don't want to get into is a situation where you're torquing like this and your tip is getting too close to the surface, right? You always want to be down and uniform. One of the nice things about this machine is they've done a really good job with the tonal alerts. You will learn very quickly what they mean, and so you'll be able to focus on the patient instead of constantly looking at the numbers on the machine. Okay, so again, I'm just still pre-tunneling a little, making sure I'm not going to run into any hang-ups anywhere. And we're going to come up into the jowl from this access point, and that's where we'll start. Okay, so looking at our depth, we have a nice layer of tissue coverage. We're going to close down over the tip, and you'll hear the pedal. What I'm going to do is I'm going to, on that initial contact, let my temperature rise close to my goal, and then I'm going to start withdrawing slowly. You'll hear the beeps increase as we get to temperature. And now we'll start withdrawing with our goal. I'm going to be quiet so you can hear the sizzle. Our goal is to keep it as close to our temperature goal without hitting it. Remember, once you hit goal, your energy is turning off, and so you're no longer delivering anything. So now we'll move down to the next level. And again, I'm adjusting my pace to keep my temperature hovering as close to 65 as I can. One thing you'll notice is I'm never coming all the way back to my entry site. And in fact, what I'll do for everyone is I'll mark off. I'm going to mark off a zone there so you see where it's, you don't want. What happens is if you keep coming too close, obviously if you're working on a wedge, you're going to wind up over-treating that initial 1 to 2 centimeter area. I hope the camera can pick it up, but you can kind of hear that snap, crackle, pop. So just sort of mark yourself that 1 to 2 centimeter margin of safety, and you know not to come back and cross there. And she's getting a great response. Thin areas like this, we're just going to do one pass over everything will be more than enough. Can I have a sponge? Little counter tension. Just again, the most important thing is monitoring the depth of that tip of the cannula and making sure you're consistent. If you get superficial is where you can start getting some thermal injuries. As long as you're cautious, you should never get yourself into a situation where you have something permanent, but you don't want to start seeing these little blisters forming. And I'm always sort of double checking and feeling that tip and making sure I have a nice cushion. That last beep you just heard was the temperature surge warning. So not only is the machine monitoring temperature, both internally and externally, it's also monitoring the delta of the temperature or how fast it's rising. And it will cut you off if you get too much rise in your temperature, which is a great safety measure. Almost always happens when your tip is too close to the skin. So when you hear that, you're going to back off the pedal, come out with your cannula, and come back into a new plane. So I'm going to just come back and do one extra pass over the jowl, and then I'm going to show you how we kind of sweep. So now that I've gotten all my tissue to goal on my deep temperature, I'm going to try to get my external skin temperature up a little bit as well. Now we know we see collagen genesis as low as 30, 32 degrees, but I'll try to get a little closer to that 38, and here we'll use kind of a sweeping technique. So just back and forth. Now again, you need to make sure you're well undermined here, because when you're moving quicker, it's easier to kind of pinch and get caught near the surface. So I'm always torquing away from the skin, and I'm always moving. And if I get stuck, I come off. And here I'll kind of focus on smaller zones, just trying to get that temperature up. And we're approaching 35. You'll see we'll start to get a double beep as we get a little warmer. That's our double beep. We know we're within range here. And to me, that's plenty. And we've delivered 1.1 kilojoules to the neck. I don't base my treatment on energy at all. I base my treatment on temperature goals. But I use my energy for symmetry purposes. So although I'm not looking at how many kilojoules I'm delivering while I'm treating, once my treatment is done and I've reached my temperature goal here, I know I'm going to be right around that 1.1 kilojoules on the other side as well. Okay? I'm just going to come around for a little better access. You're doing great. You tolerating this okay?
Yes.
Any pain at all?
Mm-mm.
You feel any warmth?
No.
No, good. So if you touch, you can feel definitely a significant difference in skin surface temperature on the side we've treated versus we haven't. And if you look, our straight line has become curved, and we've definitely pulled tissue in this direction here. So same thing, we're going to enter. Okay, confirm we have good undermining of our cannula. You can see anywhere I don't know if you can pick this up, but sometimes as you're advancing, you'll see a little pinching of that skin. And I know that I'm going to just back up there and retunnel. Okay, and just make sure I have nice, good passage. So as we come over that jowl, depth really important. That's where our marginal branch is crossing, and I'll pinch and make sure I'm at depth. And we'll start our treatment. Let our temperature rise initially, and then I feel there's a significant margin of safety in moving this constantly. So you'll see, except for that initial, now I'll cross my safety region once to make sure I'm treating that area, and then I know not to come back over that. I'll come back up on the jowl, give a little extra dose. That last sort of gong buzzer you just heard was the machine detecting a lack of contact, and that's because my cannula and the surface probe were separated when I initially stepped on my foot pedal. So again, another safety measure preventing any arcing or any delivery of energy without the surface temp monitor in place. So each patient will heat at a variable rate, so your pace is going to adjust based on your thermal rise. And it's pretty easy to maintain a constant pace there. If you do fat injections, we were talking about on withdrawal, similar concept. I think it's hard for surgeons to adjust moving at this pace, so you just kind of have to let the tones hypnotize you a little bit, and once you start seeing results, you'll understand a little bit of patience is well worth it. So almost done with our neck, and then we'll come up into the face. There's that temperature rise. So you see I'll come out, check my tip, make sure I'm at good depth, and come back in. On this side, we're getting nice heating of the skin and deeper tissue simultaneously, so we won't need to sweep as much. So we've now delivered equal amounts of energy to both sides, and now I'll just do a visual assessment for symmetry. If I see any areas a little fuller on her, I feel like there's a little extra fullness here, and I'll just come in and do some localized treatment over that area for symmetry. I'm going to come right in here and just kind of zoom over this area gently and try to get that up to the surface temp. So you can hear the different beeps. So that triple beep is our target internal temperature. When you're hearing that triple beep, you're not delivering any energy, so you might as well move on to a new area. You may have also heard a double beep. That is our surface temperature within 2 degrees. So I always think double 2. We're 2 degrees away. You know you're approaching your surface temperature. Anything within 2 degrees of your surface goal is going to be an effective range anyway, and so you can continue moving at that pace. Okay. That's the neck. That's all it takes, okay? I tend to do my suctioning first. You can come in now, suction out your hot oil. What I will always do to make sure it's not pooling there is I'll just take a moist gauze and roll anything out. She has virtually no fat in there, so we're not going to see a lot of that coming out. But any fluid that collects is easy to milk out. Okay, and we're going to come in and treat over here. I'm going to lower my temperature for the upper face now down to 60 from 65. Little thinner tissue coverage here. We want to be a little more conservative. And this is going to be a quick single pass over the area. Okay, so same thing, we'll enter. This is going to be that tighter zone, so we're going to get our conductive goo. And again, just confirm a uniform depth and easy passage of the cannula. Let me see the marking pen. I'll just mark a little safety zone here. Careful. Little safety zone around our entry point. Okay, that's a tight adherent area anyway where you don't really need to be delivering too much. Test your tip always. If you're not deep enough, just come back and readjust. And we'll just start delivering our energy. You can see when you're that superficial, you heat really quick. And again, I don't know if the camera's picking it up, but we're getting that great snap, crackle, pop. And you can see the patient is very, very tolerant. I'm going to skate up to, but not over the branch here. Feeling a little heat? Okay. And now just a quick flush, get a little bit of thermal skin heat over here, and you can see it's just kind of that sweeping, smooth motion. If I come up against any resistance, I don't push through it while I'm firing, because that's when you're going to wind up coming up too close to that dermis. You hear that double beep kicking in, and we know we're good to go. And that's it. That's the whole lower face. You can already see her jowline tightening up. We'll do the other side, and then we'll come in through the commissures and do a quick little tightening of the perioral area, okay? So I already did the jowls. All right, here we go. So you can see we're moving a little faster here than we did in the neck. With the thinner tissue coverage, you're going to get your temperature rise a little quicker. I did 65 in the neck and 60 in the face for temperature. You can see why some people call this machine the slot machine. But I'll tell you, the tones, the first few times you use them, will drive you insane. And then your brain will very quickly learn what they mean, and it really allows you to focus on the patient and watch the cannula and the tissue, as opposed to staring at that screen worrying about your temperatures. You doing okay? Good. So same thing, we've gotten most of our deep temperature goals, so I'll just do a couple passes here to get that skin temperature up closer to our goal, waiting for that double beep. And it's about to kick in as we creep up on 36. That's it. And we've gotten essentially the exact same energy delivery we did on the other side. That triple beep, it's cutting us off. We're at 38 there, and so there's really no point. If you needed to deliver more energy at that point, you can take out some cold ultrasound gel from the fridge that'll cool your surface temperature, keep it from cutting you off, and you can come back in and continue to heat the deeper tissue. Okay, now we're just going to come in through your lips. Okay, so I'm going to have you open your mouth gently a little bit like that. I'll take the 16 gauge. So just inside the oral mucosa on the commissure. We have it. Same thing on this side. And that's it, same thing, you want to just make sure you're under my head. Here we're going to really just do a quick little, we're going to stay away from the nerve, okay? And just a quick little run. 1, 2, you've got a really nice tightening there. And we'll do 3 passes right up here for the last one. You can see how quickly that heats up. Okay, I'm going to come around and just do the other corner. So same thing, you're staying at depth. One. And this is one of those areas where you can watch it tighten up as you pass. I wouldn't recommend this on your first case, but if you've done a bunch of necks and you're starting to feel more comfortable stretching out into the face, this is definitely a nice, easy, safe area. That's it. When we're all done, the stab incisions really don't need any sutures. Sometimes I'll put a little 6-0 in the neck if we need to. These are small enough that we'll just close them with little steri strips and be done. Just a little cold water. I'm going to clean you off, and we're going to put a little Band-Aid on there, okay? You did great, hon.
Thank you. You did too, Dr. Altman.
Thanks. Did I do a good job?
You did.
Awesome. And then the girls will apply a little pressure dressing. I tend to do some like toppy foam, lipofoam, whatever you want to call it. There's a million different brands. I'll lay that over any areas, and then a typical sort of facelift sling bandage. I try to get them to wear it as long as possible. The more compression you give them, the better. I find with the faces, compliance can be difficult, but I really stress to try to get them to keep this thing on at least 48 to 72 hours, round the clock, and then if I can get them to wear it when they're in the house for the next week or two. She'll be able to walk out of here on her own, and tomorrow, if she wanted to, she'd be able to go to work. There's very little post-op pain. I always prescribe them some low-dose narcotics, so they have it. If we're not doing lipo, just a little Tylenol 3. Most of the patients don't take it. They get away with Tylenol. This does such a good job of hemostasis that I'm not worried about giving them NSAIDs either. So I let them take Motrin or Aleve after the procedure. If I'm doing more aggressive liposuction or other surgeries with it, I'll have them hold off the NSAIDs, but otherwise no problem. In the face, we'll do some sort of viral prophylaxis if they have a history of cold sores. In terms of what to see, they'll see some immediate, they'll go home and be very happy with what they see. Obviously, they're going to be wrapped up, but when they take that off the shower in a couple days, they'll see an immediate improvement in the neck. And then I always tell them that the immediate improvement tends to be the deep tissue tightening. And then as the collagen starts to reorganize and reform on the dermis, they'll get improved tightening and an improved appearance as well. And then by the third day, they're usually sending their friends in to get the procedure. They're looking good and they're feeling good. So it's nice. You get a lot of early referrals on this because there is a lot of instantaneous gratification, which although patients always want, not all of our procedures are able to give them. But with this, they really do. They see a result right away. They feel really good. And I'll tell you, everyone that has this done with us, as long as they're not too jealous, they're sending their friends in very quickly because it's just an easy process. All the way over this way. Great. And that's it, hon. Okay. You may notice a little weakness in the nerves from the injection. Smile for us. Big smile, big smile. So you see she's got a little weakness in her corner, totally expected. She's got motion there. That doesn't appear to be any type of nerve injury at all. That'll wear off as the anesthetic wears off. Can you blow a kiss? Perfect. Okay.